Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain body connection and learn how to optimize your health. Dr. Sai Khan, welcome to the show.
Thank you so much for having me here today.
So
Truly
I'm
honored.
I'm excited to talk about PANS or PANDAS. So what are some of the symptoms that parents should be looking for with this?
Okay, so first let me start off with what PANS and PANDAS is. So PANS stands for Pediatric Acute Neuropsychiatric Syndrome, and PANDAS stands for Pediatric Acute Neuropsychiatric Syndrome due to strep. So PANS is this overlying umbrella condition, and PANDAS is a part of it. So as far as symptoms go, if you have a child who has a sudden acute onset of neuropsychiatric symptoms such as anxiety, OCD, ADHD, severe brain fog, anorexia, they just stop eating, urinary symptoms or sleep symptoms, their handwriting has deteriorated, or they have developed sudden rage. Those are the kind of symptoms that you're going to see with PANS and PANDAS. So by definition, it's an acute onset. Also, another symptom would be tics, which you are likely typically going to see with strep. So if you're seeing any of those symptoms develop in your child suddenly, then you really need to be thinking about PANS and PANDAS. It's not a psychiatric condition as such. It's an inflammatory brain disorder. And there is very little recognition of it in the medical community at large.
Yeah, and that's actually where I was going to go was, that, hey, if your kids have this, you're probably gonna get brushed off at most clinics, whether it's pediatrician, primary care, a lot of neurologists, still don't admit it truly exists. And so it creates a lot of almost kind of chaos because now you'll get, right, especially the parents who are desperate, they're bouncing from one provider to the next. And it's like, well, this provider says it doesn't exist, but this provider says it does. Um, so now that we understand, right, this is a pediatric condition, you've talked about some of the symptoms kids have. Let's go into a little bit about what actually is happening in the brain. Let's start from kind of the immune side, because for me, when I treat someone with this, it's immune system, immune system, immune system, right? Whatever controls the immune system controls the outcome. So what's kind of happening in the brain's immune system in these kids?
Basically, there is this concept of, it's a fancy word, molecular mimicry. There's a part of the brain called the basal ganglia, which gets affected in PANS and PANDAS. And that part of the brain basically controls your emotions and your behaviors. And it can get affected or attacked by antibodies, which are generated in response to an infection or a toxin. And sometimes stress can also be a trigger for PANS and PANDAS. So generally, those are the kind of broad category. So you get an infection or the child gets an infection. And I think the one thing I would like to point out is that there may be adults who have a similar condition. It's just not pediatric. It was recognized for the first time in children, and I feel, and many experts feel, that there are so many adults who may have been missed cases of PANS and PANDAS. So basically, when you get an infection or you're exposed to a toxin or even something such as anesthesia, your immune system generates antibodies against that infection. Now, there is similarity of those antibodies against parts of the basal ganglia in the brain. And the brain gets attacked or the basal ganglia gets attacked. And that's what causes PANS and PANDAS. So as a result of that immune attack on the brain, there's a lot of inflammation. It's like your brain, that part of the brain is set on fire. And you get those symptoms of anxiety, OCD, anorexia, so forth.
Yeah, and I do want to follow up on this, because people hear the term, pediatric in both of those, right? Um, is this something that kids age out of? Because that's something parents ask, like, oh, well, if it's pediatric, is my kid gonna age out of it? Like they would maybe a food allergy that they have when they're little that doesn't impact them 5, 10 years down the road.
Unfortunately, they don't. They have this genetic predisposition. Their body, they um, basically have some predisposition where their body's not able to turn off that fire. So if you have that genetic setup, you can't get rid of the genes. What you can change or modulate is the environment. You can reduce the exposure to the toxins, you can treat infections, um, but you don't really age out of it. So these children can have episodes or symptoms even later in life. And they're adults. One scenario which people generally understand very well now post-COVID is that people developed neuropsychiatric symptoms post-COVID. So COVID is one of the reasons of PANS and PANDAS. Um, so you can get that. People have got that as adults. So you really can't age out of it. It was initially recognized in the 1990s in a pediatric age group, and the initial definition was that you really have to be prepubertal. But you see PANS and PANDAS in older teenagers. You see it in um, young adolescents. So you really can't age out of it. But you can reduce the triggers or reduce the susceptibility to the triggers by working on your body using a functional and integrative approach.
Okay. Now, before we really go into what that approach looks like, what an evaluation looks like, I want to go into some of the spectrum of symptoms. I know when I first got exposed to treating kids with PANS and PANDAS about 11, 12 years ago, right? The clinic I was at, I mean, we were getting, I mean, it was bad, right? Um, are they always that severe, or is it like, hey, what parents, there are these things that you may, it may not be extreme, but it could be a warning or it could be something you see with it, right? Because it's just like autism, which we'll talk about next, right? There is a spectrum. So what should people know on that?
So again, this is a spectrum. Let me give you an example. Take asthma, which is an inflammation of the lungs. Do you always get a severe asthma attack? You don't. Sometimes you can have an episode that lasts a day or less than a day. And sometimes you can have episodes that go on for several days. So, the same way, this is really a spectrum disorder. When you get into the history of these children. So, first of all, a lot of them are not recognized right away. There is increasing awareness, but several years ago there wasn't. So, I see kids in my practice who have been missed for years. And when I look at their history, they may have had episodes of, say, tantrums as little babies or, as toddlers. They were just hard to console. Their parents would hold them or have to control them for literally an hour or two. And, they would take them to their pediatrician, and it would be dismissed as a family interaction issue or a parenting problem. And as time went on, those tantrums got worse. And then, they got into school and they developed anxiety or, some other psychiatric condition, and they were referred to a child psychiatrist or a developmental pediatrician. And then they went on vacation somewhere and they were in a moldy hotel, and all of a sudden they have this acute onset of OCD and anxiety, and they just are stuck doing something and they don't want the parents to leave the room or something like that. So usually in my experience, it's not always an acute onset. Like there are these clues in the history that have just been missed, unfortunately.
If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying. Yep. And, we'll talk about that just really quick, because it's easy when it's a my kid got an infection, right? And here's what happened next. But there's others where it's they've unknowingly lived in a moldy environment for 6 months, and then you see a breakdown of what's happened, and people think about, well, it's pediatric acute, and they're like, well, what acutely happened? It's like, well, there's this process that went on. So, does it have to be necessarily acute, or is it just more of a, hey, that's just what they say because that's when the symptoms start? You consider it an acute symptom, even though the process was kind of pushing someone there.
Exactly. So I think we all have heard that analogy is the straw that broke the final straw that broke the camel's back. So in functional and integrative medicine, we use this concept of a bucket. So you have a tap filling a bucket, and at some point the bucket overflows. So you may have all these insults at the level of the body to the child. Their diet may not be perfect. Um, they may have had a history of infections and been treated with antibiotics, so their gut health is not perfect. They have shifts in their microbiome, and then they move into a moldy environment, and they've been living there. They're constantly getting exposed to the toxins, and at some point, that bucket starts overflowing. And now they get, say, a strep infection or influenza or COVID or something, and all of a sudden they get this dramatic onset. Or with mold, especially being in Florida, I see a lot of mold, and 100% of my population has mycotoxin exposure and immune dysregulation due to mold. So especially with where mold is concerned, you don't always see that acute onset. That's been my experience, at least.
Yep. Yeah, I've definitely had some cases of that where they're like, thinking back about it, before all these ticks started, we were in a moldy place, for like a year. And it started during that time. It's like, oh, and it's these things that, once again, mold isn't even really accepted yet in regular medicine. I remember working on a neurology unit in the hospital, and the neurology residents would actually make fun of people who would say they had mold issues. Like, yeah, they just say it's mold or they say it's Lyme, and they just kind of move on. Which we're definitely going to talk more about both of those because I know with what you dealt with, which was narcolepsy, which is for a lot of people, it's actually an autoimmune disorder within the brain that causes excessive fatigue and everything else. And really a lot of the things that you did to find answers for yourself can also be done to help people with PANS or PANDAS, because at the end of the day, these are immune system issues within the brain. The only difference is just how it manifests. And so you've got these immune cells in your brain known as the microglial cells. For those that haven't heard of it, basically they kind of sit there, they survey, they clean up. Based upon the signaling they get, they may cause inflammation. They may signal repair, and you want them to shift back and forth based upon the signals they get, but they shouldn't become pushed too much in one direction exceedingly long. So before we go down the deep end, because we'll go there, but let's go to testing. Let's go to testing. Are there good tests that people can get done for PANS and PANDAS, or is it better to do it through a symptom base? I know there's a lot of debate on the testing.
Absolutely. So first of all, the one thing that I want everyone to understand is that this is a clinical diagnosis. PANS and PANDAS is a clinical diagnosis. It is diagnosed based on the symptoms and clinical exam if that is possible, but essentially the symptoms. The testing is not perfect. If you were to go to regular labs that are covered by insurance, those tests, I've actually never, not even once, if I've done them, first of all, I don't do tests looking for brain antibodies using conventional labs. If I've ever done them, they've always been negative. Now, there are some companies out there that are considered specialty companies. They're not covered by insurances. They will look for brain antibodies in the blood, And they can also look at them in the CSF. The conventional ones can look at them in the CSF. Those tests can pick up some of those brain antibodies, but I don't typically use them. If I were to spend money and um, if a family has financial constraints, then I would rather spend the money on specialty testing looking for the triggers, such as mold, such as Lyme and co-infections, where again, the conventional testing often misses the diagnosis. So I use those for the diagnosis, like what's the underlying root cause or causes. But as far as looking for brain antibodies, I'm not really going looking for them unless we're considering IVIG, which I really don't use very often in my practice. And if we're running into an issue where we have to convince the insurance company that this is a case of PANS and PANDAS.
Yep. Yeah, that's where having something like the Cunningham panel, can be decent. But even then, we know that's not a perfect test. And like you said, if people have financial issues, I mean, that test is like $1,000. Maybe
Uh,
it's, you know, and so with it being more, of a clinical diagnosis, as you said, based upon symptomatology, kind of the onset and all of that, let's go into what I'm going to consider more of the basics, right? For me, when I approach cases, I like going off of foundational things. Um, because mold, yes, it's often a player, but sometimes it's a step too early. Um, and I'll ask people like, well, what are the 3 to 5 things that makes your kid do better, or 3 to 5 things that makes your kid does worse? So if we look from like foundational things, what are things that people should consider that they should be looking at from like a pattern perspective, whether, it's the foods they're eating, right? Sleep and other things that we would consider almost like functional medicine essentials, really.
right. So the foundations, absolutely. So I start off by telling the parents to keep a symptom diary. And, they can even start that before they get into a practitioner's office. So trying to figure out what kind of symptoms are triggering. Very often, you need to make dietary changes. So the common things that can be triggering are foods such as gluten, dairy, sugar, processed foods with natural flavors. Natural flavors are often coming, they will have soy or gluten in them, or they can be corn-based. So those are the kind of things that you need to think about. And you can even eliminate them beforehand or before you can actually get to a practitioner's office because they are triggering. MSG is also present in natural flavors. And that is something that I've seen. A child ate at a Chinese restaurant and had a rage episode, for instance. So those are the kind of things you need to think about. Um, Now, the brain detoxes during sleep. There is this concept of glymphatics. And lymphatic clearance or lymphatic drainage, that's something that's not very well recognized in conventional Western medicine. But it is a concept that is very well recognized in other medical traditions, such as Chinese medicine, for instance, or naturopathy. And so the brain is detoxing during sleep. So making sure that the child is getting good sleep through the night, going to sleep at a reasonable time, 9 or 10 o'clock, and then, sleeping through the night, waking up in the morning versus staying up till late. Because that's when the brain is detoxing through the glymphatic system, which is the brain's lymphatic system. And then, physical activity, getting sunlight, just the basics. Those are the foundations. And as far as diet is concerned, making sure that they're getting adequate protein, getting lots of vegetables and fruit. And, for some kids, they are, as far as the overlap with autism, some of these, especially if there is a child who's on the autism spectrum, they may be really picky. So you have to take baby steps. You just can't remove things all of a sudden. I recommend that parents do one thing at a time. Remove one thing for 3 weeks and see what kind of an effect it's having on the child's symptoms and behaviors. And then, go on to the next one.
Yep. And as people notice improvement, I tell them, just don't even try to bring it back. Don't play with fire. If you know pulling gluten out, pulling dairy out makes a big impact. It's not worth having little cheats because the immune system, it's on the fritz. It's very, you know, pushed in the wrong direction and it doesn't need any extra help. And it's not worth what, gets the outcome. And then, as you said, with sleep, it's also stress. And I'll tell people really like start with that. And sometimes they're even frustrated with me. They're like, what do you mean? Like, why won't you do more? It's like, look, let's make nutritional changes. Let's make sure your kid's sleeping good. Let's get them physically active and reduce any unnecessary chaos in their life because we all consider these things simple, but when you add them up, I mean, they're super profound. And some kids, like, you do that and they're like, my kid's 90% better, you know? And you may not have to go down the whole rabbit hole that we're going to go down next, right? Whereas there's other kids, you do that and you may not even move the needle or you move it 10 to 20%. So now we're going to go down that rabbit hole. So I know whenever you were dealing with narcolepsy, which once again, is, for most people, it's autoimmunity to certain parts of their brain, which once again, PANDAS is very much autoimmune as well. Um, you had a lot of things that you identified as contributors, and now there's a lot of overlap between these, and these are very confusing for people, when they see different providers because they often get tons of tests ran at once. And then it's like, well, what gets priority when? So let's just kind of start down because we know mold is a big, big thing. And then for the sake of this, let's just throw mast cell activation in there together because it's, so many people with mast cell activation syndrome really just have mold issues. It just overlaps tremendously. So I'm gonna let you take it on that.
Absolutely. So mast cells are these cells which are lining our body at the interface with their environment. So for instance, the eyes, the skin, the gut, the nose, and the sinuses, all those areas have these cells called mast cells, which are like a defense mechanism. Now, what mold does is, or mycotoxins, which are the toxins that you get from mold, they are going to activate these mast cells. So they get kind of sensitive to environmental triggers and they can get cranky and just shoot out whatever is in them. So they have over 200 chemicals in them. And when mast cells get activated, they will release their chemicals in response to a variety of triggers. These can be anything from stress to something in their environment, a moldy environment. It could be foods. Uh, and they will cause a variety of different reactions, starting from anywhere from, skin rashes, hives, breathing issues, fatigue, brain fog, headache, abdominal pain, all kinds of symptoms. Even in a menstruating female, heavy periods can be related to mast cell activation. And mold is one of the big causes, and one of the big environmental causes of mast cell activation. And you see that very often in patients who are, mold sick. There is a component of mast cell activation in PANS and PANDAS and also in autism. So
Yeah.
lots of overlap. And in my own journey with narcolepsy, I also had mast cell activation as a part of my illness. And I believe it was triggered in response to being in a moldy environment.
Yep. Yeah. Mold, I mean, it does so many things and it really loves the brain. I mean, it loves messing with nervous system tissue. And that's why people get so many symptoms with it from not only the central nervous system, like the brain fog, headaches, dizziness, word finding, but also they can even have, they're the people with the weird nerve issues. They're like, wait, what? Like that doesn't even make sense, and because of that, they're often brushed off with, things that we don't necessarily talk about. But Um, Now with mold, let's go into the testing, right? So I used to do urine testing. I've kind of left that behind, and now I do blood testing to look more at the immune response. Um, where are you at on the testing side?
So I'm still doing the urine testing and I'm thinking of trying out the blood testing. Are you talking about the My Michael lab
Yeah, for me,
testing?
it's my micro labs, or it'd be just really anything that's more of showing the immune response versus just purely the body excreting, whether or
Sure.
not.
So I think, so as far as what I do, so far I've been doing the urine testing, but when I do it, I tell people that testing is not perfect. Um, None of these tests really would be perfect. Each of them has its own limitations. So if you're doing urine testing, you have to remember that it's going to be limited by the body's ability to excrete the toxins in the urine. Now, in somebody who is extremely sick, they may not be excreting the toxins in the urine anymore. And for that was what I experienced when I did my initial urine mycotoxin test. It was completely negative, but I was so sick that uh, I decided to go ahead with the treatment. And later on, my test became positive. So with the urine test, that's a limitation. And generally, when I do it, I use some thing to provoke, such as glutathione, or have the patient take a warm bath or use a sauna so they can mobilize and move those toxins around in the body so they can be excreted in the urine. And as far as the antibody test is concerned, I have used in a few patients even Quest testing for penicillium and Aspergillus and Stachybotrys. There is IgG testing available through Quest, and that can be a clue to mold exposure or the body's response to mold. And with the other testing that you're talking about, I haven't used that, but sometimes I've had patients bring that to me. And from what I understand, there are two things that you look at. Um, there is an IgG antibody, which basically indicates that there is mold exposure, and the IgE antibodies are indicative of mast cell activation from what I've heard, and probably you can shed some light on that. But the thing with the antibody-based testing is that you have to remember that it's based on the immune system's response. So if somebody's immune system is suppressed, which mold can also do, then you may not um, always see the antibodies. And perhaps you can talk about it more since you do it.
Yeah, so you're looking at both, and the difference is when you're doing a Quest test or one of those, you're typically looking more at the mold itself versus with this one, you're looking more at the mycotoxin. So those are, that's going to be a little bit of a difference. But then the other thing is, I did have that question because one of their advisors, I talked to him. I was like, well, what if people have pretty much none IgE? He's like, look, you can still run it. I was like, okay, like, but that's kind of the thoughts on that end. And they actually changed their test. It used to be a color spectrum of like yellow, orange, and red, and they changed it to just red because they're like, look, it's not about how positive you are. It's about any positivity is still an issue. But I also notice, lots of people that do have this, as I went some patients with it, not all of them, but a lot of them, they even just have skin prick tests from their allergists that they're just like, man, they just light it up. And sometimes when they have that, I'll still run the mold test, or sometimes if they're, really got a budget issue, I'm like, look, you're lighting up to all of these grasses, these weeds, the pollen. I'm like, you've got something that's completely jacked up. Let's just go after it. Um,
Totally, it makes sense. And the budget is one issue. And then in some of our populations, like we're dealing with complex issues where they could have multiple things going on, and then you have to figure out, where you're spending the money. Their gut could be messed up, they may have Lyme and co-infections. So by the time you add all those things, it is a hefty amount. But certainly, I think in Florida at least, and also in so many other, I mean, more than 50% of buildings are supposed to have a mold issue. And a quarter of the population is supposed to be susceptible. So it's just one of those things which is a huge problem. And I think the one thing I didn't mention was that I was trained as a toxicologist, a conventional medical toxicologist. I formally board certified. My boards lapsed when I was really sick. But as you mentioned, you just don't learn about this in conventional medicine. There is no awareness, and people laugh at the patients who are talking about mold illness or the sick building syndrome and those kind of things. So the awareness is just, or the recognition is just not there.
Yep. Yeah, I know. I mean, I've had people where I'm just like, you have to leave your work. Like, you've got to work from home. And they're like, oh my gosh, I'm working from home. I'm like 50% better. I'm like, your building was keeping you sick. I'm like, now that we've done that, now we can actually move to the next phases, and we'll talk about some of the potential options for treatments. But next I want to go into is, right, so we've talked mold. And we'll just go for this now. I don't do as much on this side because my personal opinion is that it's overly blamed by certain groups and then probably not recognized enough by other groups. And that's going to be Lyme disease and co-infections. Like, when is it something that's an issue versus when is it something that, like I'll hear stories of people like, oh, well, so and so got bit by a tick like 10 years ago and they fell apart 2 years ago. And for me, my mind's like, I'm not necessarily as worried about the bite then. I'm worried about what broke the immune system, like when is the positive finding of Lyme or any of those co-infections something that should be addressed versus when is it hey, this is just a sign the immune system's off, just like cold sores, right? Cold
Right.
sores, if you get the immune system under control, you're not going to get outbreaks. So let's kind of talk through that a little bit because I mean, I've had people spend 30, 40, $50,000 at these Lyme specific clinics where it almost seems they're trying to make way more out of it than they should, but I also don't want to say Lyme is never an issue for people either.
Sure. What I'd like to say is that we're a product of our experience. I mean, that's something that one of my mentors, the golden words for one of my mentors many years ago. And my practice has sort of evolved, and the way I practice has evolved. So initially, I was taught that mold is, the underlying problem, and once you treat the mold, everything else falls into place. Now, I don't think we live in that perfect world. And in my own situation, I treated the mold. I actually treated it for about 3 years. I was really sick and I did the detox, I did the antifungals, treating the sinuses, treating my gut, all of that. I still had fatigue and I would still crash in the afternoon. And at that point, I said, you know what, I'm missing something. And I tested myself and I had Lyme and co-infections. And you throw COVID in the mix. COVID is also going to dysregulate people's immune system. And that's been the story over the last 4 years or so. So as my practice has evolved, I have started looking for Lyme and co-infections earlier in the process rather than just focusing on the mold because I've realize that I can get people better if I'm addressing the mold and the fungal burden and the Lyme and co-infection piece at the same time or in close succession. So it saves time unless a patient is really sensitive and they can't handle a lot of treatments, in which case we really have to go slow. And that's where I generally start with more of a detox and then layer in the other treatments. And I feel like, I've learned from different people and different experts in my journey, and each person's approach is different. So I've kind of tried to um, mix it all up. And when you're looking at some of the children with PANS and PANDAS, um, for instance, rage. If they have rage, then you need to think of Bartonella and mold. And treating the Bartonella really helps them early on in the process. I've had children, for instance, where they've had congenital Lyme, and they had a story of being a colicky baby and tantrums. At some point, moved to Florida. I mean, that's a classical story in my population. They've lived somewhere in the Northeast. They were doing kind of okay, multiple tick bites, and then they landed in Florida in a moldy home. And shortly afterwards, they got sick. So certainly the mold is an issue. It dysregulates the immune system, suppresses the immune system, makes whatever else is, the body's controlling come out and come to the surface. But at least I'm finding that it's getting me get results in most of my patients, not all, faster if I'm addressing both the issues simultaneously or in quick succession.
Yep. Yeah. And I don't think it necessarily has to be an all or nothing, it's a, hey, you know what? If you've got your nutrition, you've got your sleep, your kids, you're doing the right supplements, you're addressing mold. And then, hey, if you're not seeing the improvement you should be seeing in 3 to 6 months, maybe you then go deeper. But if you are, then it's like maybe you don't, right? It is kind of, we go back to cold sores and stuff, right? There are those who it's just like, look, they need that extra support. You've got to go after it. Just like with Lyme and the co-infections, there are those where it's just like, you need to go after it. But then there's those where you don't necessarily have to. Um,
Absolutely. That's true.
and then, I know there's something else that, that you were dealing with, and I don't know that we necessarily see a ton in kids, but you know, we can definitely see it more in teenagers and then adults. It's when we start getting into the right mold doesn't necessarily have to be the causative factor, but we start getting into the gut issues, SIBO, and not even just SIBO, but we just look at more of dysfunction within the gut, whether it's intestinal permeability, leaky gut to inflammatory responses from the gut, lipopolysaccharides, and stuff like that. What are things that, you know, people should consider and you consider when you're evaluating these cases and working through them with kids?
So looking for gut symptoms is important. I start, that's getting a thorough history and that initial intake is really important. You can get gut symptoms as simple as constipation. I mean, just from being in a moldy environment, I've had people come to me where they will give that story that they have constipation and they go for vacation for a couple of weeks somewhere and the constipation goes away. Or people who know that they're living in a moldy environment and they sleep in a tent for a week and the constipation gets better. So you get these dramatic kind of stories, but looking for all kinds of gut symptoms, constipation, burping, bloating, which can be a sign of SIBO, gastroesophageal reflux, diarrhea, all kinds of symptoms indicate that there is some imbalance and dysfunction going on at the level of the gut. And then mold will cause increased intestinal permeability, or what's commonly known as leaky gut. So larger undigested food particles will go through the gut into the blood, and you also get leaky blood-brain barrier, and they go to the brain and they can affect the brain. The same way toxins from the food and microorganisms from the food can get into the blood, and the lipopolysaccharide, which is the bacterial cell wall, uh, that also gets into the blood and affects the brain. So mold will cause leaky gut. It will cause disruption of the immune system of the gut. It will cause mast cell activation. So when you eat certain foods or several foods, your mast cells can get triggered and you can get a variety of symptoms, including symptoms that involve the rest of the body. So basically, the gut can be affected in so many other ways. and dysbiosis, imbalance of the bacteria in the gut.
Yep. So now, so we get those issues, right? We know that gets varied just even whether the mom had a natural birth versus a C-section, to bottle fed versus breastfed, to the foods they eat, right? And trying to get things rebuilt and back on track. And I think it's hard, because some people often blame changes in bowel habits when they're traveling. It's like, oh, well, it's because they're just eating different food, and there's a lot of explaining things away. Um, but I know initially when we're talking about kind of your approach with what you've done, is it's not very medication heavy, like talked about IVIG. There's different medications that people use on mold. There's also you get those that are doing Lyme at some clinics, right? And they basically get a pick line because they're getting that much antibiotics. I predominantly treat teenagers and above, but I do treat some kids with this as well. And one of the biggest struggles when we look at kids, right, it's getting them the right things to support their immune system, whether it's to quiet down the inflammation in the brain versus to help them fight something they need to fight, and to get them to even take it. It's different when it's a 15-year-old and they can swallow pills. So, what are some of the things you like? Because I know a lot of the parents out there that are trying to find stuff for their kids. It's that battle because not all of them, but there's a decent bit that do have even sensory issues and texture issues where they're just not going to do it. So yeah, what do you find is useful on that or things you kind of lean to?
So there are a few things. One, I tell the parents that at least with the children where you can make it non-negotiable, you make it non-negotiable. They have to do this before they can do this. Before they can watch their show, they have to take their supplements. And with supplements, I've tried, multiple different things. I like incorporating them into smoothies, if possible, if the smoothie can mask the taste, or mixing them in nut butters. There is a cup called Oraflow, which can be very helpful, especially in children with autism, where, even with little children, sometimes you have to use the supplements. Like the autism population is certainly one where you have to get them to use the supplements to replenish what's missing in the body. And, a lot of these children are really picky. So trying multiple different approaches helps, but certainly it is one of those challenges. So, you know, you really have to sometimes limit the number of things that you can actually give and, prioritize. So using basic things like, omega-3 fatty acids, curcumin, serum bovine immunoglobulin to help the gut. You can use zinc carnosine. A lot of these things can be incorporated into smoothies, for instance. And even, basic things like switching to olive oil or adding some olive oil, uh, you know, extra olive oil to the food. Uh, all these things can help towards reducing the inflammation in the body. And then, there are multiple other supplements that can also be used to reduce the inflammation. I also use glycerides from certain companies that are not that don't have a bad taste and that are easier to administer in kids in the form of drops. So those will also help reduce the inflammation from companies like Beyond Balance, for instance.
Yeah, so it sounds like you're using a mix then of powders, liquids, and then even just pills you're just opening up.
Yes, yes,
Yeah.
absolutely.
Yeah,
And
so
then,
I've helped.
in a severe case, and sometimes we resort to medications also. Like if you have an acute flare, like even from a diagnostic point of view, if somebody doesn't know that their child has PANS and PANDAS, giving ibuprofen can help sort of identify, like if they respond to ibuprofen, you know that this is a case of PANS and PANDAS because you've used an anti-inflammatory that's easily accessible. And my practice is virtual, so sometimes, there is a delay of a few days for the family to be able to get the supplements from the virtual dispensaries. So we have to have I have to have a system that works. So I start with some of those easily accessible things.
Yep. Yeah. Because there's, you know, issues where people are always, trying to, right? We almost think like autoimmune based issues, like, oh, well, it's because the immune system's overactive, right? But you kind of get both sides. You get the sides where these kids get sick frequently, and it's like, oh, every time they get sick, their ticks go crazy, their behavior goes nuts. I'm like, those are the easy ones because it's highly predictable. But then you get the others who are like, honestly, the kid never gets sick, so it really is both sides of the immune system. So so we've talked about diagnosis, we've talked about clinical issues. Now, I do want to talk a little bit, and we've talked about it briefly, but kids can have more than one thing.
Of course, we don't live in a perfect world.
So we're going to go into kind of the weeds, there's kids that are just autistic. There are kids that just have PANS or PANDAS. And then there are kids that have autism spectrum, and then they get PANS, PANDAS on top of it. So, you know, how do you even begin to think through that process as you're working with people?
So, autism is a neurodevelopmental issue. It's something that is generally not acute in onset.
Mhm.
You're going to have a child who has had these symptoms short, since an early age. They've had social interaction issues, poor eye contact, they've had repetitive behaviors, and they've had sensory issues. So they were really sensitive to touch or certain clothing textures or foods. They were picky eaters. That's the general kind of an autism spectrum picture. And then, you have children who are in regular schools really smart, but they have some of those characteristics. And then there are children who are really developmentally delayed with those characteristics. So that's your autism spectrum disorder. Early onset, it's not acute. It's those signs and symptoms have been noted from an early age. Whereas PANS and PANDAS, if you are to consider just by itself, you have a completely normal child. They may have something like asthma, but not neuropsychiatric symptoms or developmental symptoms. And then, they're 5 or 7 or even 3 years old. And all of a sudden, they have this acute onset of any of those symptoms that I talked about of PANS and PANDAS, anxiety, OCD, anorexia, ADHD, brain fog, rage, urinary disturbances, sleep disturbances, Tourette's or tics, any of those. So that's PANS and PANDAS. Now, what I find, and I'm not sure if anybody's looked at the numbers, but in my population, a lot of these children have autism of varying degrees. Some are really developmentally delayed, whereas others are really advanced intellectually. I have a patient, for instance, who completed her high school when she was 13, and she's on the autism spectrum, and she also had PANS and PANDAS. So you can have a child who's on the autism spectrum. And again, with autism, you have that inflammatory process going on in the brain with the microglial activation. So you know that they're predisposed to brain inflammation, and then something triggers that attack on the basal ganglia, whether it's an infection, whether it's a toxin, whether it's stress, even a situation, for instance, a child was bullied at school. And that stress of being in third grade with another child who was bullying them triggered the PANS and PANDAS when they had all these other things that were going on in the environment. So, um, if you have a child with autism, for instance, and you're seeing these kind of behaviors coming up or suddenly coming up, then you really need to, again, think about PANS and PANDAS.
Yeah, but I think it's important, to not necessarily just explain away everything because it's very easy to look at kids with autism and be like, oh, well, a lot of kids with autism have anxiety or they have some depression or they have some social withdrawal or anger issues. and to not just be like, oh, well, it's a little bit worse, so it's just got to be what they've got, versus being like, hey, well, maybe there's something else layering on it. Because at the end of the day, these are both neuroimmune issues. It's just kind of when it occurs. We know autism, it basically starts in utero from neuroimmune issues that ultimately impacts the development of the brain, versus PANDAS is a neuroimmune issue that it changes basically the functionality of brain networks that, once again, changes behavior. Um, so now I know we've talked about a lot of things that can be done from testing. We even talked about some of the different supplements. We've talked about nutritional changes. Are there any additional functional medicine strategies for reducing neuroinflammation in these children, whether it's autism or PANS or PANDAS, that people should think about?
So working on the gut health, the gut is connected to the brain, making sure that you work on that leaky gut or increased intestinal permeability. That is really important. We've talked about the foods, working on the removing the mycotoxins, using different detox strategies such as binders or sauna, castor oil packs, all those kind of variety of things will also help with the gut health and the neurological health. Um, Working on mitochondrial health using different supplements can again reduce the oxidative stress on the brain and the body and help these children get better. So it's really working on all those pieces and again treating the infections. That's the
Yep.
other piece.
Okay. And then, let's bring the parents into this. The minor cases, it's not that big of a deal, but on the more severe cases, what are some of the tips for the parents? Because, the more moderate, especially the severe ones, I mean, it's very consuming, it's very draining on these parents, and it just weighs on them so heavily. I mean, many of them, they can't get babysitters, because they just don't know what's going to happen when. And 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 because of what's happened, it's even hard to calm down the tantrums when it happens. So what's some advice, that you've given parents in the past when they go through this journey, because it is emotionally taxing on them, and we want them to be able to get through it, because, like, we all know no one helps 100% of these cases, but a lot of them can do really well, but it's also having the patience and the bandwidth to get there.
Absolutely. So I think uh, having a child with PANS, it's an extremely difficult scenario. It affects not just the child, but the entire family. It affects both the parents, the relationship of the parents sometimes. I've seen that. I've seen parents who've gone through divorces because they had a child who was really sick and nobody knew what was going on. They didn't have a diagnosis. They were running from doctor to doctor and just trying to control this child who was raging, and then having disagreements between themselves. The siblings can get affected because they're not getting attention. So it's really working on the family at a different level. The parents have to work on making sure that they get to spend time with each other. They pay attention to the child who is not affected, and they don't blame the child who is affected as if this is a problem, as if this is a behavioral issue, which a lot of times their pediatrician or psychiatrist or therapist may actually tell them. They may tell them that, they're not just being a good parent, unfortunately. So
Yes.
that's that's really important. And then trying to have a good social network um, is also important, a support network, and knowing that they're not alone. There are many other people that are out there. And so I think that is also really important in
Yep.
this situation.
Yep, yeah, it requires a lot of patience, understanding there
Mhm.
are other people, and just also don't compare yourself to other people. Don't compare your kid to other people's kids. People who respond at a different rate to care. What acts as a trigger for one may not do anything for the other. Um, so we've covered all sorts of information, over about this past hour. Is there any last little bit of parting wisdom you really want someone to take from this conversation?
Yes. I think for the parents with children with PANS and PANDAS and autism, I want to tell them that there is hope for them. There is hope. They just have to look outside of that conventional Western toolbox. Um, in my own journey, I learned firsthand as a doctor who turned into a patient that that conventional Western toolbox is really limited. There is a role for it. I don't want you to completely abandon it, but healing is possible, but you have to look at other modalities. You have to get into, functional and integrative medicine. You have to look into other treatments and other therapies that are out there to get better. Now, it does end up being a financial investment. That is the other thing I tell my parents. If there are parents who would spend on a private school for their child, so they need to think of health just like that, because unfortunately, a lot of the treatments, testing, they're not covered by your insurance companies. So they really have to, unfortunately, take things in their own hands to ensure the health of their child.
Yep, and it's not the fastest process either, as
Yes.
I tell them when I take these cases, I'm like, look, if you're not willing to go with me a year, don't even start, because this is not the fastest thing, right? I treat a ton of concussions and that side, like concussions, we work through that pretty fast. But I've actually switched what I'm doing now on the whole other side to a membership model because I was getting too many autoimmune patients that would do a month or two and get frustrated because they didn't, you know, hit a home run. And it's like, look, these conditions are not the easiest. And it takes time. There's going to be some hiccups along the way. There's going to be bumps and bruises. And so, yeah, I mean, parents, if you're going to go down this route, know that it's a process. It takes time. But also, I want to say there is a time where you've got to have a provider that you trust who also is aware of their own limitations, because there are times where maybe a
Mhm.
provider brings you 50% and then you need to pivot to another provider who can bring you further. And there's nothing wrong with that. It doesn't make the first provider bad, for bringing you 50%, because there's no guarantee that the other one could have brought you the whole 100 either. And realizing that sometimes you need a different thought process. But I do tell people is don't put too many in the mix. I think you'd agree with me on that too. It's like, hey, don't treat with us and then another one or two providers where you're trying to please everyone at the same time, because that just adds more chaos into what is already a challenging situation, and chaos doesn't go well with this.
Absolutely. I think, too many cooks can spoil the broth. So you can use the same analogy here. I think my approach has been that, I again completely 100% agree with you. These cases will need a year, 2 years, 3 years, even more sometimes, depending on each person or each child, to get to that final destination. In my own recovery, it took me a few years to get here, but they need to have the patience. And then if there is absolutely no improvement, say in 5 months, like zero improvement, then they need to look somewhere else. But if things are moving, if they're making improvements, there are good days and bad days, but the general trend is that they're improving, then they just need to stick the course.
Correct. That trend is super important because people often latch onto the bad time and they'll be like, well, my kid had this. And it's like, yeah, but how often did that occur? It's like, based on what you told me, it's like that's 25% less times than it previously did. So don't let the fact that a tantrum could still occur mean that you're not seeing improvements, right? It's a mix. So this has been great. So if people would like to learn more about you, where would they do that?
So I have a Florida-based virtual practice. The name of my practice is Rebalance Family Health, and the website is www.rebalance, REBALANCE, Family Health. Um, I'm just going to be launching a new website very soon. And my Instagram, if you want to follow me on Instagram, is DR, my first name, Saima, and then my last name, Khan. So SAIMAKHANMD. And you can follow me on Instagram for other tips.
Okay. Awesome. Well, Dr. Sima, it was great having you here and to talk about through the complexity of PANS and PANDAS. Thank you for joining me.
Thank you too. It's truly been an honor.
If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcast or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have and should seek the assistance of their healthcare professionals for any such conditions.